And buckle up. Happening today, President Trump is taking his economic message on the road, kicking off his affordability tour in Pennsylvania.
So the president vowing to bring down the cost of living. He's expected to deliver a message, deliver a speech reminding voters he has not forgotten about his campaign pledge. White House Press Secretary Caroline Leavitt just previewed the speech for us.
We look forward to going to Northeast Pennsylvania tonight, and President Trump is going to give a positive, economic-focused speech where he talks about all that he and his team has done to provide bigger paychecks and lower prices for the American people. And you'll hear stories of everyday Americans tonight who will benefit directly from those tax rebates next year. You look at the massive deregulatory effort from President Trump and his team, which is saving American households and small businesses money.
Right, so he's going to be pumped up with that speech, and I think it's going to be the beginning of him trying to push his own message, because Democrats have been effective with pushing their affordability forward.
Totally. And all of this comes as the health care debate heats up on Capitol Hill, even after the historic government shutdown. Senior congressional correspondent Chad Pergram joins us with the details. Good morning, Chad.
Hey there, guys. A crisis looms in January if Congress fails to address spiking health care premiums. Senate Democrats want an automatic 3-year renewal of Obamacare credits. A test vote comes Thursday, but some conservatives oppose re-upping any of the aid.
Look, the attention on Obamacare, the failure of Obamacare has been wonderful. But let's don't exacerbate it by extending these COVID-era temporary subsidies. Let's let them expire.
Republicans have decried the Democrats' plan as a messaging bill which will not pass. But Democrats say Republicans lack agreement on their own plan.
I think we'll have a vote this week. But a vote is not enough if we can't come to an agreement. We achieved the lowest number of uninsured Americans in our country's history. Millions more Americans suddenly had peace of mind of having quality health care.
Republicans are mulling a host of plans, but the GOP hints it might not even vote on a Republican option. That's because they lack the votes. One bill from GOP Senators Susan Collins and Bernie Moreno extends the Obamacare credits for 2 years. It also places caps on who is eligible and imposes other reforms.
We know people need assistance here with affordability in a number of areas. We're working on bipartisan solutions that can actually pass, that include reforms so that we reduce this medical inflation.
Now, here's what likely happens on Thursday. Expect nothing to pass. Then after that exercise, lawmakers get serious and work right up until Christmas to try to find a solution. Now, remember that health care was central to the government shutdown. Guys?
So, Chad, I see the Republicans have a few plans out there, and it looks like they say, I'll go with your words, that Senator Thune kind of likes the Cassidy plan, even though there's a bipartisan problem solver plan with Congressman Brian Fitzpatrick and Josh Gottheimer. So do you think they could all work together on this? Are these guys going to be in their own lanes on this? How do you see this playing out?
It kind of depends what Republicans want to do. They have to coalesce around something. The Democrats have coalesced around something, but that's not going to pass. Nothing will pass on the Republican side until they coalesce around something, and it has to have bipartisan buy-in. You have to get to 60 votes in the Senate, and time is of the essence. Now, you're right that John Thune, the majority leader, he name-checked this plan by Mike Crapo from Idaho, the Senate Finance Committee chairman, and Bill Cassidy, who chairs the Health Committee in the Senate. That's important. But again, it seems like they're not quite sure where to go yet. But if something fails, sometimes we see this a lot of times in the Senate. Once they have something fail, then everybody gets really serious. And there is nothing that forces members to do anything like a deadline, and nothing that forces members to do anything like a deadline around Christmas. Now, we've known about this all fall. That was the, essence of the government shutdown. So, I suppose after they get done Thursday, everybody takes a deep breath, and then Republicans say, what do we do on affordability? They feel that they're getting hammered on this. Some of them are starting to maybe break a little bit with the president because they say, we have our own reelection we have to worry about. And if we don't do something to address this issue, we're going to get cooked in the midterms.
So, Chad, what is the buy-in? Because a lot of Americans, they heard the president say, I want to give you the money. And then I'll let you decide. If you want to use that money for health care, great. If you don't and want to use it towards some of the affordability crisis, that's also great. What's happening on Capitol Hill when it comes to that type of proposal?
Yeah, that's something that people have mulled. You know, certainly these health savings accounts, you know, there's differences of opinion about how that would work and how people could use them. There's some argument that you don't really save much at all and that it puts more onus on the, you know, the individual, which is fine. You know, people say, OK, let's get this away from the health insurance companies. Let's put it in the hands of the people who are actually going to the doctor. But a lot of people, as you know, they don't manage their money maybe as well as they could and maybe are confused by those plans adding another layer. You know, they're expecting to just, you know, having a reimbursement sent in through their health insurance, you know. So, you know, that cuts two ways. So that may help a little bit, at least on the ledger side, but getting people to actually do it, that remains undetermined.
Thank you so much.
Yep, it's pretty agreed. They got to do something.
They're going to have to do something so
you.
that the premiums don't go up.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.